Jackson 16 WAPT News begins with breaking news.
We have breaking news this afternoon. Governor Tate Reeves speaking now at his daily COVID-19 briefing with members of the Mississippi Coronavirus Task Force. Let's listen in.
Please stay strong. Stay in the fight. We can see the finish line, but the push to the end requires all of us to sprint. We are at or near our peak in Mississippi. This is the most painful time. This is the hardest time. It is the beginning of a turning point, but we have not gotten past our peak pain yet. I pray every day for an end to this COVID-19 crisis, and we are all acting together to protect our people. We have been through other trials and overcome. We will come through this also. I know that what is being asked of you is not easy. It's not even close to being easy. We also know that the collective work of our people is having an impact. The damage could be far, far worse. Our projected pain is coming down dramatically. It hurts, but it is working. You are saving your neighbor's life. When we avoid death, we only see the cost of the sacrifice. But please know that you are saving lives every day that you stay in the fight and every day that you stay sharp. We cannot eliminate the burden that comes with all of this. Our enemy is doing great damage, not only to those who catch the disease, but to those who have lost the ability to provide for their families. We can't yet fully stop the mental, financial, physical cost to you and your family any more than we can fully stop this virus. We can help lighten the load. Today, I want to share two new programs that we hope will help. The Mississippi Home Corporation has just authorized our hardest hit funds to provide short-term help with the mortgage for Mississippians who lost employment or significant income due to COVID-19. If you have lost the ability to earn during this crisis through no fault of your own, and you are at risk of losing your home, we can provide temporary help. It will not take over your home payments indefinitely. It will give you time to get your head above water, to find work, and to become self-reliant again. It may provide a one-time payment to make your mortgage current. It may also pay your mortgage for a time while you try to find work. I saw firsthand the homes that were lost to the tornadoes this weekend. It breaks my heart. There are more who are at risk of losing their home to our nation's economic crisis. We can't stop the wind from blowing, but we can try to stop more from losing their homes. You can go to mshomesaver.com to get more details and to apply. At this time, I'd like to turn this over to Scott Spivey from Mississippi Home Corporation, who is administering the program. Scott?
Thank you, Governor. Yes, so this is a program that's been in existence since the financial crisis in 08 and 09. These were TARP dollars that were repaid to the Treasury and authorized to provide mortgage assistance in 18 states plus the District of Columbia. They will expire next year. We had set aside some for blight elimination, and in coordination with Governor Reeves' office, are going to take this opportunity to move about $10 million that's remaining in the program for blight elimination back over and reopen the mortgage assistance pipeline. Homeowners can apply online, like the governor said, at mshomesaver.com. They'll be referred to a counseling agency that's in their area. We're working with a network of housing counselors to gather all the documents and submit them to the Mississippi Home Corporation for underwriting. This program will provide up to 6 months of mortgage assistance. So it is temporary, but it's important to note, and I think the governor's done a great job in these press conferences of explaining this, but forbearance is not forgiveness, and it's not forever. If people are putting their mortgages in forbearance, that debt still exists. And that's one of the reasons this is going to be an important program, so that they don't have to go into loss mitigation and they don't have to come up with a number of mortgage payments when forbearance is finally over.
Thank you Scott, and Scott will be available a little later for questions on this particular program. At this time, we are also working to address one of the most taxing issues. Our essential workers are being asked to do things that others aren't. They are stepping into the line of fire to provide what we all need to stay safe. We need to do everything that we can to help them. We are not talking about robots whose lives begin and end with their essential work. These are Mississippians just like you and me. They have lives, they have homes, and many have children. Children that are now out of school for the rest of this semester. We have asked child care facilities to remain open to provide them with the ability to take care of their children. That is not easy. Today, we are providing some more guidance and more help. The Mississippi Department of Human Services and the Mississippi Department of Health are activating their Child Care Crisis Assistance in Isolation Response, or their CCARE plan. This plan provides temporary emergency child care facilities during the crisis period for the families of essential workers, people in healthcare, first responders, and those keeping food and supplies in our homes. This is for people who do not have access to typical providers of child care. The sites will not be around forever, but they will meet all the standards of typical child care facilities. In fact, even more during these unique times. The state is working to find potential partners as we speak. They'll get free of charge training through the Early Childhood Academy, and they'll be assigned a coach to help them operate smoothly throughout this emergency. Anyone, churches, businesses, nonprofits, individuals who has the capacity to operate according to the guidelines can offer to open one of these emergency child care sites. We are asking those partners to step up now. If you are willing to become a partner, please go to mdhs.ms.gov/CCAIR, which is Child Care Crisis Assistance Isolation Response. As these sites begin to operate across the state, they will begin outreach to parents. If you need financial assistance to afford this emergency child care, you can apply for that assistance beginning 1 week from today. We hope that this expanded access to child care will lighten the load for our essential workers. It won't make their jobs easy, but we hope that it can make this one highly stressful element a little bit easier to deal with. At this time, I'm going to turn it over to Mr. Bob Anderson. I want to commend him on the job he is doing at the Department of Human Services, the stressful circumstances under which he took this job, entered this job, and how grateful we are to the work that he and his team are doing in these challenging times. Bob?
Thank you, Governor. This obviously is a new concept, but it's not a new idea. The idea is that parents who have children and who need to be at work, whether they're doctors, whether they're first responders, whether they're sanitation workers, whoever they are, if they need to be at work and they have children, they need child care. And this CCARE idea was put together by our Division of Early Childhood Care and Development in order to come alongside existing child care providers who are still in operation. But one of the realities that we know right now is of about 1,500 child care providers across the state, somewhere around 900 of those are not operating right now. So about 60% of them are actually not in operation. And we all can understand why. They're concerned. They're concerned about their safety. They're concerned about the safety of those children that they care for. And they're following the governor's orders that we shelter in place to the extent that we all can. We expect parents who can do that to continue to do that, but those emergency personnel, those healthcare personnel who have to be at work, we want this CCARE idea to make it one less thing they have to think about, that they have emergency child care opportunities available to them if their traditional child care provider is no longer operating. And as the governor's already said, anybody can put together and stand up one of these CCARE sites. It can be a church, it can be a Y, it can be, we've talked with museums about doing this. And our role at MDHS is to simply be a partner with those who are willing to provide the care. We have a training packet that's available on the website that the governor already mentioned, and we just want to be a partner to providers who are being a resource to those parents who need this care for their children. Thank you, Governor.
Thank you, Bob, and Bob will be available for questions in just a moment. Thank you to your team for making this possible, and I know that there are going to be a large number of individuals that take advantage of it. Now, we saw 273 new cases of COVID-19 reported in our state earlier this morning. We reported, unfortunately, 11 more deaths. We are in the eye of the storm. Please, Mississippians, stay smart, stay safe, protect yourself, and protect your family. We will reopen our economy soon. We have to. It's not going to be an option. Lives are at stake due to a rapid increase in poverty as well as this public health crisis. No business is non-essential to those who rely on its paycheck for food, for supplies, and for shelter. Today, this posture is preventing imminent death. It is not forever. It is a temporary tool, and the time is coming to safely move beyond it. I hope and pray that it is very, very soon. At this time, I'd like to ask Dr. Dobbs to speak towards the where we find ourselves today with respect to COVID-19.
Very good. Thank you, Governor. As the Governor mentioned, we have 273 new cases and 11 deaths. If we look at the racial breakdown of those, 56% of the cases are African Americans and 66% of the deaths are African Americans. Again, something that we find wholly unacceptable. We've had a total of 66 outbreaks within long-term care settings. Our definition of an outbreak is a single case in an employee or a resident because we take these things so very seriously. As we talk about some of the things that Department of Health is trying to do, I do want to make sure everyone knows that we're going to target some of our testing resources in the communities of greatest need. To that end, we are doing a testing location today at Mississippi Valley State in Itta Bena, trying to identify individuals who might be infected. And then tomorrow, we have a testing set up for Lexington in Holmes County and also in Woodville and Wilkinson County. So if you live in one of these areas and you have any of the symptoms of COVID, I strongly encourage you to go to UMC's website. They have a teleportal where you can do telehealth or a phone number if you want to call and register to get tested. And this is free of charge, and they'll give you an appointment. So please, if you live in one of these areas and think that you might be infected, we want as many people as we can to come through these testing locations. If we look at sort of our preparations for the surge of hospital resources and the need for that, we continue to see relative stability in the number of COVID patients in the hospitals and in the availability of ICU beds and ventilators. If we look at yesterday's numbers, we have 149 patients and suspects with COVID-19 in intensive care. We have 275 open intensive care unit beds. As far as ventilators go, we have 100 COVID-infected patients on mechanical ventilation, which is relatively similar to yesterday's number of 99. And we have 631 available ventilators for future use. Again, as the governor said, we are kind of in the eye of the storm. It's very important for us to maintain our vigilance. I know we're all getting tired of this. It's really easy to sort of slip back, but right now is so important. And I just really want to talk to our young people out there. I've got some young people and I know how impatient they are. And, please stay vigilant, stay at home, stay away from groups, don't socialize, because even though, and you might get sick, certainly young folks do get very sick, even though it's less likely, but you're going to bring it back to your family members, your friends, people who are vulnerable, and those folks certainly are going to be a lot more prone to have severe illness and even die. So do it not just for yourself, but do it for your family and the ones you love. Thank you, Governor.